Ladies and gentlemen, please welcome Louise Melling, Deputy Legal Director of the ACLU.
Hello, everyone. I'm delighted to be here with you and be part of People Power. I'm here to talk to you today about the Republicans' vision that leadership announced this week for the Affordable Health Care Act, for Planned Parenthood, and for Medicaid. So that means I'm here to talk to you about health care, but I can already tell you know it's about more than health care. That's important. But this is also, it's about discrimination. It's about dignity. It's about decency. It's about our lives. It's about the values that we hold dear, the America we want to celebrate. So let's start. Let's go with affordable health care. So let's refresh about what's at stake. To my mind, the Affordable Health Care Act is the most significant civil liberties and civil rights piece of legislation of this century. The Affordable Health Care Act, what it did, it has saved and changed people's lives. It's lifted 20 million people from the ranks of the uninsured. It's made it possible for people to have health, to live. It barred discrimination based on pre-existing conditions. It's barred discrimination based on gender. It gave us no-cost birth control, among other services. It bars discrimination because you're a transgender person. It gave incentives to the states to expand their Medicaid rolls, making it possible for the working poor to actually have insurance. And with more Medicaid, we got more services, more people with disabilities able to access the kind of support that enables people to go to work and to live independently, to live out the civil right of not being in an institution. I see you agree it's worth fighting for. So what does the leadership, what does the bill have to say about this? Well, the bill doesn't say things specifically about what I just said. What the bill does instead is attack the very structure of the Affordable Care Act. It attacks the financing in terms of how much we give out to people who are in need, about how much we tax other people so that we can actually help other people. As I like to say, it kicks the very legs out from underneath the stool. Already, the American Medical Association, the American Association of Retired People, hospital associations around the country have come out against this bill. And why? For reasons we all care about. Because this bill jeopardizes the health insurance and the health and lives of millions of us and the people we care about. Is that what decency looks like? I think it's time we're going to step up for this one. So that's the Affordable Care Act. Let's talk about Planned Parenthood now and what this bill does. This bill says Planned Parenthood can't be part of the Medicaid program, full stop. This bill says that people who are on Medicaid, if this bill were to pass, can no longer turn to Planned Parenthood as their trusted provider for their cervical cancer screening, their mammograms, for their birth control. This bill, if it passes, will force many health centers, Planned Parenthood health centers, to close. Planned Parenthood, the facility that 1 out of 5 women in America turn to at some point in our lives for our health care. And why? Why is Planned Parenthood targeted like this? Or as I sometimes say, blacklisted like this? Because Planned Parenthood provides abortions. There you have it, from the word of the man, right? Planned Parenthood, it doesn't provide abortions through the Medicaid program. Federal Medicaid bars coverage of abortions. That's a whole other story for us. Those services are provided through other programs. But this bill, this act, this action, the vision of the leadership pushing this is that Planned Parenthood should be stripped of participation in Medicaid because it provides a constitutionally protected service. Because it provides a service that gives us, that gives women a chance to actually control our lives. Body, my choice, yes. Is that what decency looks like? Is that the America that we stand for? Are those our values? This is worth fighting for, right? So now let's go to Medicaid. What does it say about Medicaid? So today in America, what Medicaid is, it's what we call an entitlement program. The federal government promises that it will contribute money, if you are eligible for its services, to pay for the services it covers. It's going to take care of you, within boundaries. This bill would change that entirely. It would be a radical transformation of the Medicaid program. This bill says, we, federal government, we are going to cap the amount of money we will give toward any single person. We will send you, state, a certain particular set of money for a person who's eligible for Medicaid. That's all you have. What does that mean? That means fewer dollars, fewer services. Fewer dollars, fewer services for the most vulnerable of us, for the people most in need, for the most essential thing, our health, what gives us our opportunities to enjoy any other aspect of our lives. The harm will be felt most acutely, I think, by people with disabilities. What Medicaid does, and I think a lot of us don't know, I didn't know this until recently, what Medicaid does is it doesn't only provide for services, cover healthcare services for people with disabilities, it provides support. It provides payment for support that enables people to go to work and to live independently, to live out that civil right, that civil liberty of being outside of an institution. Should we cut that? Is that what decency looks like? Are those the values that we're going to stand up for? I don't think so. So that's bad, right? Let's also just talk about the process for a second. So this was unveiled on Monday. By Wednesday, this was already in committee for what they call markup, amendments consideration. The Republican administration, the leadership behind this bill, wants it to come to a full House vote by the end of March. They want it on the president's desk by April, before they go home for their visits, before they have to face you in their home districts. So less than 2 months to think about a program that would deny health coverage for millions of us, for millions of the people we care about. Less than 2 months to totally radically reform a program, Medicaid, that's been in place for 60 years. I was about to say 60 decades. That would be amazing. Is that what we think is fair? So, but here's what we have. They've got some weeks where they want to get this through. We've got some weeks where we can stand up and tell them, no. So what can we do? What can you do? We already know that it matters if you talk to your members of Congress. You all saw those images of what happened in April. We saw four senators change their responses as a result of hearing from their constituents. Let's hear it for Alaska, Colorado, Ohio, and of course, because I'm on stage, yes. I've forgotten one. So we need you to call, tweet, write your members of Congress. We need you to tell them your stories of why this matters. We need you to speak the values by which you live your lives, the values that motivate you to come forward. Whether you speak matters. It matters to the members of Congress. It matters to the woman now on Medicaid who goes to Planned Parenthood for her health care. It matters to the man in a wheelchair who's able to go to work because of what Medicaid has done. It matters to the rural woman who's able to get insurance because of the subsidies about the Affordable Care Act. This is for the people, by the people. I'm asking you today to pledge that we're going to come together and stand up against these visions. And we're going to stand up against this, stand up against the ACA. We're going to stand up in the name of decency. We're going to stand up in the name of care. We're going to stand up in the name of dignity. and we're going to stand up in the name of fairness for all. Game on.